communication skills in couples counseling. And when doing this, when helping people, it's important that we use the necessary skills and techniques to do the counseling or through the therapeutic process. So it's important we know these skills and how to use them appropriately and at what point, so that our interventions get the results we intended them to be. So before hello?
Reverend.
Hello, Doc.
Do we wait for others to join or she can continue?
Please, we are almost 40, so please let's continue.
All right, okay. So, Doc, please go on.
Okay. So before I go on, I would want us to go through a very simple experiment for ourselves. Before we take care of other people, we have to be sure that we ourselves, we are taken care of. And so it's important we have this discussion that you have to know where you are at so that you can help other people. Okay, so please let me roll the slides. Okay, good. There are 6 basic emotions: happiness, sadness, fear, disgust, anger, and surprise. So if where you are is safe and comfortable, if you are not driving, but you are stationary and you are safe wherever you are, I would want you to close your eyes. Close your eyes and observe the emotions you are currently going through yourself. Is it happiness? Is it sadness? Is it fear? Is it disgust? Is it anger? Is it surprise? What emotions are you going through right now? What kind of psychological space are you right now? Are you in crisis? Are you struggling? Are you surviving? Are you thriving? Or are you excelling? What emotions are you going through right now? So gently close your eyes and look deeper within. What emotions are you experiencing right now? Don't hold it. Don't be afraid. Just experience what form of emotions you are going through right now. Allow yourself to feel it. Be present with your own emotions. What emotions are you feeling right now? Good. Now breathe in, hold it, and then breathe out. Now name the emotions. The emotion you are going through, just name it. Name the emotion, breathe in, and then breathe out. Okay, let's go. 4 seconds, breathing in, hold it for 7 seconds, and then breathe out. Great, you are doing well. Let's go for the last time. Breathe in, hold it, and then breathe out. Great. Now, imagine yourself in a place you recently visited that you enjoyed. Let's go. Breathe in and then breathe out. Good. Imagine the dress you were wearing. Let's go. Breathe in and breathe out. Imagine the people you went with and someone saying something very beautiful to you, and that made you smile. Breathe in, hold it, and then breathe out. Great. Now imagine yourself leaving that place gently. Breathe in, hold it, and now breathe out. Gently leave the place. Breathe in, hold, and then breathe out. Now gently open your eyes. Slowly and gently open your eyes. Let's come back to class again. Okay. So I just want to ask those who were able to go through this experiment, how did you feel? How do you feel? Hello.
Great.
You feel great. Good. Thank you. Who else will share their experience with us?
Yes, I can. Your first exercise is the 6 emotions, and you asked us to go through the experiences of thriving, surviving, sad, what we're experiencing. In my case, I would say that I am thriving and excelling.
Great.
The next one is the place that I visited recently and enjoyed. My recent trip was at the Presbyterians Conference in Worcester, and the people I met, including our own clerk of the NAP Presbytery, Dr. Awuku-Gyampoh, and the Presbytery president or chairperson, Dr. Reverend J.J. Kumi. The people I met were very good. There were so many things that we had and discussed and talked about. It was excellent. So I will leave it here for someone to take over unless you want me to proceed or say some more.
Okay, thank you for that wonderful submission. Okay.
Thank you.
So can we have a third person share their experience with us, and then we move on?
Yes, please.
Okay.
This is Fred. Yeah, the initial was mixed emotions. I wasn't really experiencing one particular emotion, whether it's sadness or anger or, fear, but it was kind of, mixed. However, the last place that I went, I attended a party. It was enjoyable, and I met great people and had great conversation with them. And so that's my experience. Thank you.
Okay, thank you very much for your discussing with me what you experienced during this short experiment. The whole idea is for us to be aware of ourselves and be present with our own emotions. Because if we are going to take care of others, then we should be in a certain frame of mind to be able to take care of them, because couple counseling can be very intensive and may demand some psychological energy. And it's important that as counselors, we are in the right space so that we can do that very well. So if you are in crisis, or you are struggling, or you are surviving, is an indication that you must deal with whatever concerns or struggles you might be going through, so that you get to a point of some emotional and psychological stability to help you help others as well. Because if we are going to help other people, then we should also be in the frame of mind to be able to help them. Thank you. So what is couple counseling? Couple counseling, also known as couples therapy or marriage counseling, is aimed at helping couples improve their relationship and resolve conflicts. So basically, this is what we intend to do as counselors, to help people. We are in the helping profession. And so the whole idea is to help other people to live better. Okay. The goal of couples counseling is to enhance understanding, strengthen relationship bond, and develop healthy ways of interacting with each other. And so this is what it intends to do, to help couples and help their psychological and mental and general well-being. Okay. So a little statistics to show that couples counseling can be very effective, in the sense that research is saying that 50% of marriages will end up in divorce, and 60% of people who remarry will end up in divorce. And so the issue of marriage counseling is very important, especially in the church, because if the foundation is good, the superstructure will be very strong. And in the mid of it, if people get the necessary psychological counseling and interventions, then it would also help the relationship thrive. So statistics is saying that, or current research is saying that it improved relationship satisfaction, it reduced divorce rates, lasting effect on marital stability, prevention of future conflict and relapses, improvement in individual and couple well-being. And so it's a good thing we are doing as a people, as a church, to help marriages to work. When marriages work, society works, and everything functions very well in our society. Okay, so counseling. We have internal conditions for counseling. Before counseling begins, it's important that certain things exist. We call them internal conditions. They should be there in order for counseling, to the process of counseling to yield the results we intended it to be. So the first thing is building rapport. The next thing is unconditional positive regard, empathetic understanding, genuineness, confidentiality, counselor self-disclosures. These are the internal things that helps counseling to thrive, the process to go on and do the counseling in an effective manner. The reason is we are supposed not to do any harm. We do no harm. And if we are not supposed to do any harm, then there are principles we must uphold so that we can effectively handle other people and do them no harm. Okay, so building rapport refers to the process of establishing trusting and respectful relationship between the counselor and the client. Just in simple words, it means connection, building a connection with a client. And so, hello, how are you? How have you been? Was it difficult to locate the church? Or where are you coming from? Would you need some water? Are you feeling too cold? Should I switch off the AC? Or are you too warm? Should I switch off the heater? These are things you could do just to build rapport. How has the week been? Building rapport, building a form of connection that will lead to trust, offering the person a seat and all of that. You are building rapport, establishing connection, because a therapeutic relationship you build with a client is very, very important. It's based on it that the person will be able to open up to you. And so building rapport at this stage is very important. So the next thing is unconditional positive regard. We are saying that regardless of what is said or what you hear from the client, how they are dressed, how they look, you should show them endless kindness and care. You may disagree or see flaws in their reasoning, but your job is not to argue with them, but to gently encourage them to see through things through the scope of reality. Because we all need encouragement and guidance to help us to see things through the scope of reality. So it's important that you respect them, not be judgmental with whatever, but show them kindness and then care as well. Then we have empathetic understanding. Empathetic understanding is saying that I may not necessarily agree with you, but I suspend my judgment and I empathize with you. I affirm your hurt, your pain, your confusion. I can appreciate it. I can imagine this is difficult. And in empathetic understanding, we say that temporarily assume the shoes of the person. This is what I say as an example. That imagine Jonah going home and telling his wife that I was in the tummy of the whale for 3 days. Can you imagine? I just came out of the whale of the tummy. And then Jonah would go and tell the wife the story. It sounds ridiculous, but it's true. And that is why we suspend our judgment, we suspend what we think, and temporarily try to assume the shoes of other people and feel their pain with them. And so it's affirming their pain. Your pain is justified. Don't trivialize what they are saying and belittle it, but affirm them, accept it, and let them know that you can imagine whatever they are going through might be a difficult thing for them. Okay. The next thing we talk about is confidentiality. Ordinarily, people will not want to share their problems. Ordinarily, they would want to find a way around it. And they open up to you means that they are opening up their vulnerabilities to you. And they come in already, there is some form of fear and anxiety they might have. And yet they still came to you. They respected you enough to come to you. And you have to respect them enough to keep whatever they discuss with you confidential. And so in confidentiality, you don't repeat or misuse information discussed outside of the counseling room. You don't share their story with anyone during preaching or during session meetings or during YPG meetings. You don't share their stories with or without their names, without their consent. It's unethical. The only time confidentiality can be broken is when something criminal has taken place. Aside that, you don't have to share any information about anybody with anyone without their consent. It's unethical as a counsel. Okay, now genuineness. Be honest, be yourself, be comfortable. Your action needs to reflect your words. And so if you want to do something, know that whatever you are promising is within your capacity and you really want to do it. If you invite them to your home for counseling, make sure that you are willing to see them in your home. They shouldn't come and it's as if they are unwelcome. That is not fair. So be genuine in your heart, in your mind, and most importantly, because we are Christians. So be genuine in the way you handle people and how you handle couple. It's important as a counselor that you are genuine. If you can see them at a certain time, let them know. You don't promise them to come at a time, they come, and then you are not available. You are not being genuine. You are not being honest. Okay, self-disclosures. This is when a counselor shares personal feeling and experiences or certain reaction to the client or the couple. As a common practice, it is safer not to self-disclose unless for some reason there is no other way to meet a client's need, in which case it should only include the relevant content intended to build them up. No, but someone should not come to you and then you start using your personal experiences to advise them, to counsel them. Remember, every relationship is different. Every marriage is different. And it's because the personalities involved are different. And therefore, you have to be very careful using your personal experiences to counsel people or telling them to do it your way. It may backfire. And when it does, it will look like your work is not properly done or you have misinformed them. So be very careful how you use self-disclosures. As a matter of common practice, as a counselor, it will be safer you use your principles, your skills, your techniques to do your counseling rather than bring in personal experiences, because people differ and the personalities involved in every marriage is different. Thank you. Now, let's look at the communication skills or counseling techniques. We've looked at the internal conditions for counseling, things that need to be well established, well provided for before the counseling process starts. Now we are looking at the communication skills or the counseling skills that you would have to use when interacting with your clients or the couple. Okay. For effective counseling to take place, there is a need to use the appropriate skills or techniques. There are several techniques effective counselor can choose from. Okay. So we have what we call attending, and then we have listening, we have observing, we have questioning, we have confronting, we have paraphrasing, we have informing, and we have summarizing. These skills are all used at different points in time during the counseling process. And be mindful that, as the lawyers will say, each case is dealt with on its own premise. That is why we don't do the self-disclosures. Okay, so these are some of the skills and techniques you can use. So attending means to wait upon in biblical terms, to serve, to minister to, to visit or care for professionally. When you are tending to people, it's as if you are waiting on them to serve them or to minister to them care, passion, your compassion, or to visit or care for them in a very professional manner. Okay. Attending may be categorized into three components. We have attending physically, attending contextually, and then attending personally. In attending physically, it includes building rapport with the counselee or the couple. It also involves encouraging them to talk or to make use of the help you are offering them. Okay, for instance, you are welcome and I will be your counselor and I am ready to listen to you. Just ensuring them that you are ready to hear them. And then the counselor assures the couple of his or her readiness to help. In so doing, you are attending to them physically. And then how you sit to communicate interest, how you lean towards them, or how you relax in your chair, how you show attentiveness. It's all important and it all indicates your interest to be of help. They can't be sitting in front of you and you are fidgeting with your phone and it seems you are just not ready. They say one thing and then you are looking elsewhere and it's a form of distraction. And so attend to them physically by being ready and inviting them to talk about whatever concerns they may have. Now we have attending contextually, arranging the counseling environment, whether office or in a chair or wherever, to facilitate counseling. So wherever you choose to do the counseling should be a place that will facilitate counseling. There aren't distraction, loud music, children screaming, confusion going on. There should be some calmness in the environment so as to facilitate the counseling, even if it's in a garden or on the bench. There should be a good atmosphere for the counseling to go on. Arranging furniture to facilitate the counseling process, whether face-to-face or semicircular, depending on the group you are handling, whether a couple's counseling or it's just a husband and a wife or several other couples, how you arrange the chairs or the furniture is also important to facilitate the process. If you are going to get a couple, it's important that in your sessions or in your office or in the room, use the same chairs to identify with the counselee or the couple. Why do you think this is necessary? Can anyone share their thought with us? Why you think that using the same chair with the counselee or the couples help? Can you think of anything?
I think that you know it means you are treating them equally.
Great, great, great. So that's a wonderful answer. It means that we are all equal. Why are we all equal, if I should ask? Why do you think we are all equal?
Yeah, so when they feel that we are all equal, they'll be able to open up to you.
Okay, that's wonderful. Thank you.
So
So,
also that means that you recognize the marriage as a equal partnership. You know, right? So you treat that's why you're treating them equally in that regard.
Thank you all for your wonderful submissions.
You can also say that we are all human.
We are all human. We are all human. Thank you.
And then,
so
and
you
then
see
in another way,
that
you also you share their interest. You have their interest at heart.
You share their interest. Wonderful. Wonderful. So at this point, we realize that everything we do is well calculated and it's for a reason. The reason also is not to communicate any boss and servant relationship. We are all equal in this. And there are two aspects that are sitting down. One is the counselor who is coming to help them navigate their challenges. And the other aspect is the couple who know their problems better than you do. So it's two aspects sitting down. And if it's two aspects sitting down, then we must ensure that the playing field is level. Okay. Now we have attending physically. It involves seeing the physical needs of the people. Maybe you would have to give them food. Maybe you may have to give them money, whatever the requirement may be. But be careful with this, so that people also don't end up being dependent on you. So be sure that whatever physical needs or whatever help you want to give is really within your ability or your power to do so. In recent times, I have these students as a tutor in one of the halls in the university. And sometimes we visit them. And a colleague went and visited them and asked them, how are you doing? Have you eaten? And they said, no, sir, the whole day we've not eaten. And he had to part with money he hasn't prepared for. So be careful in attending physically. Make sure that whatever you are doing is something you can sustain or something you can comfortably do without putting undue stress on yourself. But this is a helping profession, and there are times you would be required to give some physical help. Okay. Now let's look at listening. This is using the sense of hearing to gather information from the counselee's verbal behavior or spoken words. Let me give you a scenario. Assuming you came to me and we were talking, and immediately you approached me that, Gladys, I want to talk to you about something. I was holding my phone, and occasionally I will look at it and listen to you. Occasionally I'll look at my phone and listen to you. Then another time you came to me and said, Gladys, can I talk to you? And I said, okay. I was holding my phone. I put the phone down and then communicate some interest and lean towards you and hearing you. In these two instances, which one would you prefer?
The second one.
Exactly. Exactly. And so our posture, our demeanor when we are listening is very, very important to the couple or the counselee. It's important that we are listening and we are not just hearing. Sometimes we hear and we don't understand what we've heard, and it's because we were not listening. Okay. So the aim of listening is to understand what is heard. And listening is therefore different from hearing. Good listening promotes the counseling process. The counselee feels accepted and attended to. The counselee is satisfied and willing to come again. And therefore, when we are set to help or to counsel people, we should be ready for it. We should plan for it and communicate all our attention to the couple. Okay. Some consequences for not listening well leads to distortion of the message. Assuming someone comes to you or a couple come to you and they are talking to you and they start, so lately, my husband my husband, then you, the counselor, say, your husband has not been talking to you. Then the counselee say, yes, my husband has not been talking to me. Then, so because he's not been talking to me, then you, the counselor, says, so you are not happy. Then the counselee said, so I am not happy. So I'm not happy. And then because I'm not happy, then you, the counselor, will say, so you are frustrated. Then the counselee will say, yes, I am so frustrated. I am so frustrated. Then you, the counselor, will say, with the entire marriage. Then the counselee will say, yes, I am frustrated with the entire marriage. At this point, it's not the counselor telling the story. Know that it's not the counselee or the couple telling the story. Know that you, the counselor, you are the one telling the story when you are not even there. And so once you have a distorted story, you are also going to counsel from a distorted point. So it's important that you listen and listen well so that you can offer the help they need. Counselor, because you are not listening well, the story is distorted. You've ended up telling the story. So now you are going to counsel based on your own premise, and then therefore you are unable to help. Counselee feels rejected, unattended to, and unwanted, and they aren't going to come back again. Counselee may not open up. If you are not ready to listen, they may not open up. They will just be there and not say anything. And after some time, when you are all quiet and then tired of the quietness, then they will ask of their leave. So it's important that we listen attentively, listen carefully, listen to understand so that we will help. Counseling may not come again for counseling. Okay. Some of the distracted to counseling, rushing the counseling through. And so what happened? Okay. And then, okay. If you are being rushed like this, honestly, you will quickly brush the story off and then go away because it's very uninteresting when you want to share your vulnerabilities with someone only for the person to be rushing you through. Not allowing the counselee to respond at his or her own pace. You are not patient enough to listen. Sometimes in the communication or in the counseling process, the room can go dead. And it's okay. You still assure them that it's okay. I am here to listen. Anytime you are willing to talk, I will hear you. So assuring them and not rushing them and giving them time to respond at their own pace. Now thinking for the counselee or the couple and imposing your own frame of reference on them. You are not listening to understand. You have your own prejudiced mind, and that is where you are counseling from. Perhaps because you have some information, however inaccurate, and you are working with it. You will not be able to help. Okay. So some distractors listening with a prejudiced mind may not be helpful. Perhaps, as I indicated earlier on, because of a story you've heard or something you've seen. And so that is what is informing what you are saying to them. And you are not listening from a very fair position. Counseling using jargons or couples using their own jargons you don't understand. It may not help well. So you ask for clarification. Counselor occupying himself with things or herself with things other than listening, fidgeting with the phone. Nowadays, we can hardly put the phone down to listen to anybody. Fidgeting with the phone whilst listening, doing something other than listening. It's not helpful. Counselor is tired, yet persist on or insist on listening, and then you start dozing along the line, and the people are talking and you are dozing off, and you open, so I'm hearing you, I'm hearing you. Don't mind what is happening, I'm really hearing you. It's unfair to the people listening to you. So if you are tired, reschedule, and then you have a time, you listen to them. Have a clear mind, avoid all forms of distractions, concentrate on the main message as well as the details, and then break messages into meaningful pieces for retention. We will come to paraphrasing and how to paraphrase so that you break the message into meaningful pieces so you would be able to retain whatever is going on and follow the story through. Now, observing. You are not just looking, you are looking to observe and pick up details. And as a counselor, this is one of the things you have to do and do it in style. You really have to be very observant as a counselor when people check in with you. Observing is the process of paying attention and looking at the counselee or client's actions, non-verbal behavior, rather than what you heard or what they said. So you are also observing their gestures, their mannerism, and everything you are also observing because it will help you with some information about what is going on. So observing involves watching, studying, monitoring, and examining the counselee's or the couple behavior during the counseling session. The counselor uses observation to know about the client's physical behavior with regard to his or her energy level, health, feelings, congruency, behavior, and appearance. I will explain this further. So when we talk about the energy level, you are looking at 4 areas to give you some information about their body build, their posture. It also helps with grooming. You are looking at how well groomed the person is. This part really gives us a lot of information. For instance, with body build, it's someone you have known, but all of a sudden the person is losing a lot of weight. Someone you have known, all of a sudden the person is increasing in weight. These are all information for you. The posture, the way the person sits down and then just sits down and unattentive, looks tired, frustrated, and then grooming, the hair is unkempt. You could smell sweat on the person, as if the person is not taking good care of themselves, is an indication that the person is beginning to be depressed because the person is neglecting personal needs. And all these should be of interest to you, whether the clothing are smelling good or the person is even wearing the appropriate clothing for the weather. If it is cold, the person is wearing some sleeveless clothes. And if it is warm and the person is wearing jackets and all that, these are things you should observe and you should be concerned about because it's information gathering time. Non-verbal expressions, facial expression, gestures, and all of that. You are observing all of this because you are gathering information to help you during the process. Okay. Now we have summary or summarizing. How do you summarize? Sorry, I'm summarizing, observing, sorry. So observing involves positioning yourself in such a way to gather information from our environment using the senses, hearing, seeing, and smelling. So when observing, you are using all your three senses, the three senses, which is hearing, seeing, and smelling. These are all important to give you information about what is happening to the couple. Okay. Okay. Now we move to questioning. I put it in red because it's one of the useful skill you have to acquire and use it skillfully. When skillfully used, questions can be effective in the counseling interview. There are two forms of questions which may be used in counseling. We have open-ended and closed-ended questions. And how you use these questions can help you gather a lot of information about the couple or the client you are handling at each particular point in time. Okay. So open-ended questions. Open-ended questions are preferred to close-ended to enable the counselee or the couple to speak more about the problem they may be going through at the beginning of the counseling session. It's inviting the couple or the counselee to talk about his or her problem. Okay, example of open-ended questions. Could you share with me what you appreciate about your partner? Or there is something on your mind, would you want to share with me? What do you think might be contributing to the current challenges in your relationship? What do you believe needs to change in order for your relationship to thrive? At this point, you are asking them questions because you need answers from them. You want to understand their frame. You want to understand how they think. You want to understand how they process whatever might be happening. You want to understand their belief system, whatever interpretations they are putting on their current issues, conflicts, challenges, or whatever might be going on. You want to understand, and it's an opportunity for them to talk more, explain more, so that you can also be in a good position to help them. Okay, we use close-ended questions when we want specific answers. So it's useful when the counselor wants specific information from the counselee or the couple. And it's needed when we want to help the counselee to identify and define his or her problem in specific behavioral terms. For example, are you both willing to commit to making changes in your relationship? Yes, no. Do you feel satisfied with the current level of intimacy in your relationship? Yes, no. Have you both discussed your long-term goals as couple? Yes, no, maybe so. So all these will give you answers to where they are currently, because it gives you specific information to work from. Okay. So in using questions, we need to ensure that they are non-threatening. And it's important questioning are used well because it can be threatening. And when people feel they are threatened, they may not come up fully with all the information. And they start feeling maybe you want to get them, or you want to just looking for their flaws and their mistakes. And when that happens, they don't open up again. So make sure your questions are not threatening. I know Presbyterians are strict, but here you have to be very considerate and make sure the questions don't come as a form of threatening them. Okay. It's advisable as much as possible to limit the use of questions to clients if they feel threatened. You may use statements or a conversation to gather more information when you feel they are threatened by the plaintiff or by the questions you are asking. Avoid the use of the adverb why. Why questions make people feel threatened, and therefore it may not help them to bring out a lot of information. If you keep asking why, so why did you do it? Why did you say that to him? It makes people feel very threatened. And so as much as possible, use instead how, what, which, where, because why questions put clients on the spot and it might make them feel threatened. Now we have informing. And this is the counselor response to merely giving information or facts. Oftentimes, a counselor or a couple's problem, some may hinge on lack of information. And so as a counselor, you have to read. If you don't have the information, let them know that they should give you a week, a day or two. You read, you search for whatever it is, and then you get back to them with the needed information. Okay. Now we have confronting. The counselor, you use confronting when you attempt to assist the couple or the person to have a critical look at the outcome of his or her behavior. Sometimes helping people to talk, hearing themselves talk, helps them to analyze what they are hearing. And so you helping them and listening to them and you confronting them with some of the behaviors or action so that they examine it and look at it critically, and then the consequences of the behavior, it's very important. So in confronting, you are helping them to see whatever action in the past or they are about taking, the ramifications, the effect on them, on the marriage, on other people, the children, and all others. So you are helping them to see reality and then properly position themselves so that they make whatever decision they want to make from a very informed position. Okay. So the counselee may be confronted with some inconsistency or remarks or action or illogical statements they might have made, or a couple or a person might have made during the session. The aim of confronting is to help the client or the couple examine their behavior, to be free from self-defeating behavior and rather engage in a more fruitful behavior. Example, it seems like there's been a recurring pattern of argument about finances in your relationship. So Sarah, you mentioned feeling overwhelmed by John's spending habits, and John, you expressed frustration with Sarah's approach to budgeting. Let's explore this further. Sarah, when John makes large purchases without discussing them with you first, how does that make you feel? So you will discuss this with Sarah so that John will appreciate how Sarah feels. And then you may go to John and ask him also about how the strict budgeting makes him feel and help him to see perhaps John feel being a man, he's in charge of the family resources. So it should be easy to make purchases without necessarily consulting. And Sarah feels that no, in this current economic challenges around the world, we need to budget resources and approach things from a well budgeted perspective. We plan for things, we budget for it, we buy, so it doesn't affect the finances of the house. So they may have good intentions for doing the things they are doing, but the effect it's having on each of them is not helpful. So you confront them to see that the challenges or the effects or the frustration their decisions or behaviors might be having on each other. Now we come to paraphrasing. It's important to use the skill during your counseling session so that you can communicate well, understand well, and then counsel from an informed position yourself. And in paraphrasing, you are mirroring back whatever the client or the couple may have said. So in paraphrasing, the counselor rephrases or says in different words the essentials of what the counselee or the couple might have said. It involves being tuned into the keywords and ideas of the counselee or the couple's messages and translating them into simple and clarified forms. Feedback in the form of empathy is a form of paraphrasing. Okay. So example, the person might have said, or a couple might have said, I feel like you never listen to me. So you, the counselor, you paraphrase. So you are saying you don't feel heard by your partner. It's the same thing, but it's been rephrased and given more flesh and meaning to it. Okay. Sometimes when you are paraphrasing, the client or the couple might say, no, that is not what I said. What I actually intended is that. So then you paraphrase again, then the person will say, yes, that is exactly what I'm saying. So that is important why we paraphrase, because we want to be at the same level. We want to understand each other, and so that the process of counseling can go on well. An original statement from a couple might be, I miss the intimacy we used to have. And so the counselor will say, you are saying you long for the closeness and connection you once shared. So you've added more meaning to whatever it was said and expanded it further to bring out the nuances, things that were not really explicit, but you bring it out so that you work from an informed position. Note that all these sentences are paraphrases of what a counselee must have said. So you paraphrase what they have said, what you have heard. It's important to do so. Okay. So now we have summarizing. In summarizing, the counselor makes note of the most important facts or the main points of what the client has said or what has transpired so far in the counseling process. You summarize all that you've heard during the counseling session, and then you tell the couple or the counselee that, so today, this is what we discussed, A, B, C, and D. And at this point, we will be ending our session today. Make sure that you are all on the same page so that if there is a need for some corrections or alterations to be made, they are made before the session ends. It's especially so when the client has given a long winding response or the couple ended up telling a long story, but you want to put meaning to all that you've heard and summarize it well. So summarizing is important to ensure that the information trend is not lost after the client has said a lot. It is important also that the counselor summarizes all that was done, all that happened, all that was achieved during the session before termination. Now we have follow-up. So providing closure to the counseling sessions, summarizing key points, discussing progress, and scheduling follow-up appointments as needed to monitor and support ongoing growth. So you reschedule if the topic or whatever you discuss hasn't been exhausted, then you reschedule and then you follow up and make sure that whatever was discussed is going on and the next appointment and where and when you will meet again. At this point, I want to ask if there are any questions before I move on to the next.
Yes, please. I have a question.
Okay.
So, you have the couple, and one of them starts, talking about issue, and is going on and on and on and on. Is it okay for you as a counselor to interject and, tell her to, come back and stick to the main points, or you just let her go on and on and on?
Okay. Depending on the information you are looking for, sometimes they're going on and on and on is providing you some information, and you should be able to listen. But if you feel the person is digressing or not speaking to the substantive issues, you can always interject and find them to the discussion you are having. For instance, okay, Mary, you've spoken a lot this afternoon, and I'm glad you've been able to open up to me. I'm really grateful. But can you please tell me more about so and so? Then she can tell you about that one as well. So you as a counselor, you are gathering information. And depending on what information you are looking for, you can decide to let the person go on or interject and redirect the conversation.
Okay, thank you, Prof.
Thank you. Okay. Please, any more questions for me?
Yes, I had a question earlier on the chart that is oral, what was the question? I said the oral opportunity to share the discussions in counseling, is that enough, or the consent have to be written?
Well, because as a counselor, you have to keep what we call clinical notes. Whatever information not the entire discussion, but you have to have a summary of what you're going on in your sessions. And you can indicate that in writing in your clinical notes or in your counseling notes. The reason why it's important you do so is you can be called upon at any point in time. There could be legal issues that may indicate that they ever saw you for a discussion, and you would have to refer to your notes, the dates, what discussions you had, and what recommendations were made, and all of that. So you just have to keep a summary, but that note you're keeping must be confidential. It's a note that not even your wife or anybody can have access to. So where you keep it, how you lock it, and all of that is very, very important. But it's not a very detailed kind of information, but a summary so as to remember what discussions you might have had. I have had people or the court system asking about someone I had seen something like 3, 4, 5, 6 years ago and requesting for information on the person. the court requiring that information. Maybe because you are not professional counselors, it might not go there, but just so that you are also safe to some extent, it's important you keep some summary. And if the person gives you consent, indicate it in writing, and then let the person sign, just so it puts you also, gives you some comfort. That is also possible. But you can work with the oral consent so long as you put it in writing, and then the date of the consent. And perhaps you can let the person sign against it, especially if the information is very, very delicate.
Thank you.
Prof,
Thank you very much.
Prof, my
You're
name is
welcome.
Emmanuel Donko. I just want to ask a
Okay.
quick and a follow up with what you're saying. That let's say in the process of counseling, and they keep, let's say it could be both man or the woman, keep repeating occurrences that has been happening, and it's like one is not forgone, which you see that it could be the center of the issue of the challenge. How do you help to navigate that particular thing? It could be one causing a very big damage to the other party, but it's keep occurring in their conversation, and like I mean where they mean to me, why you mean they mean to me, as a mean to me and chow me the chow cry, but in the conversation every day and night you meet them, that particular statement keep coming.
Okay. Okay. We will be doing how to intervene in dysfunctional marriages, but it's important that we help this person to understand that if the marriage must go on, if we would have to make progress, there is a need for granting forgiveness. The one who has been offended should be able to grant forgiveness. It might not come easily, it might take time, but the person needs to grant forgiveness so that the relationship can move on. So long as the person intends to stay in that relationship, then the person should be able to grant forgiveness. And the one who offended should also show indication of some remorse and ask for forgiveness. It's important that is done, because if we intend to be in the relationship and we've been offended, we should be able to grant forgiveness so that the relationship can thrive again on thrust and work. So it's important, it has come up, we will be looking at it in the next session, but who has been offended must come to a point of granting forgiveness, and who offended should also ask for forgiveness and indeed show remorse and be ready to restitute or change behavior to make up for the problems or the pain they might have caused the person. Yes.
Thank you.
I
Thank
have a
you.
question which I already posted on
Okay.
our platform on the chat.
Okay.
Earlier on during your speech, you mentioned that first divorce, second divorce is bound to there's 60, 50, some percentage of yet to fail. It seems that divorce has become a stigma. What are the causes of such? What stigmatizes it, and how do we as counselors navigate to counsel counselees so that this doesn't happen?
Okay. So the statistics is saying that 50% of newly wedded or couple will end up in divorce, and then 60% of those who will remarry will end up in divorce. The reason being that there are challenges going on, and we will look at them in the next slides. Every relationship that must thrive needs to have some indicators. And most of the time, these indicators are missing in the relationship. And therefore, if a relationship will thrive, if a relationship will function well, then there is the need for care, there is a need for genuineness, there is a need for compassion, there is a need for forgiveness, there is a need for compromise, there is a need for understanding. And most of the research realized that some of these elements were missing in the marriages that ended up in divorce.
My follow-up question is that if we run into couples like that who are married the second time, and based upon the statistics that you've given, how do we deal with them? Because it seems like, if I can say, each one brings his own and excess baggage and experiences of their past. So how do we counsel them so that they can, in some way, doesn't allow this to happen?
Great.
The second time.
So, thank you very much for that question. So, you would have to investigate whether they are properly healed from the previous relationship. Most of the time, the trauma from the first relationship is carried on to the second one. And people do not make time to heal properly from the pain or the frustration or the difficulty or the heartaches from the first one. And then they bring it onto the second one. But what you can do to help is to help them to appreciate that this is an entirely different one. And the fact that the first one did not succeed does not mean that this one will also not succeed. The most important thing is looking at how do we make this work? What are the things that must not be repeated? What are the changes that must be made? What are the perceptions that must be reshaped? It's important we go through all of this so that there is no carryover. Most of the time, it happens so because we don't resolve or we don't deal with the pain, the trauma of the first one, and then we carry it into the second one. And so the traumatic experiences we might have gone through in the first one start replaying because the mind configuration has been changed as a result of the pain that we went through in the first one. So if we don't heal properly from it, we start seeing things in the light of the previous one. So when people like that checked in session, you would have to help them to heal from the past and understand that this is an entirely different one from the previous one. And this will also demand different way of looking at things. And then the principles that governs or helps good marriages to go on, infusing all those principles to help.
Thank you very much.
Thank you. So most
this
of
is
the
George.
time,
I'm sorry. Go ahead, Prof. Go ahead.
Okay. So most of the time, it's as a result of unresolved pain, unresolved trauma, unconscious thoughts, and pain that it's still playing that we've not really dealt with. We come into the second one with it and it starts giving challenges in the second marriages. But there are fantastic and beautiful second marriages. So it is possible second marriages could work and work exceptionally well. Okay. So George, please.
All right. Thank you very much, Prof. My follow-up question to the follow-up question that you just answered is, in this situation when you're counseling them, is it advisable to share the statistics with them so they know what they are getting themselves into?
Yeah, especially at the initial stages. you could share with them and help them to know that this is happening, and therefore this decision must be carefully made. A decision you can't hurriedly get out of. When you are making that decision, you have to carefully examine it and be sure of the decision you are making, because marriages are ending up in divorce. So you can share the statistics with them and help them to understand that these are the elements that helps marriages to function. And when they are not there, then obviously we could be running into a different direction. So it's important that these elements exist. I was reading and listening to a very renowned marriage counselor, and he was saying that sometimes by just observing people, he could tell what relationship will last and what relationship will end up in divorce, and at what particular year the relationship will end up in divorce, because the elements that helps relationship to function is just not there. So there are principles, there are behavioral tendencies, there are things that helps marriages to function. And when they are missing, definitely the marriage would be going in a different direction. Thank you.
Prof, please, I know you
Yes.
go but please, very quick one. You were talking about
Okay.
one not being healed, one not being healed, right? So in a
Yes.
Christian setup, let's say I've divorced for 3 years, and you see you being normal, going up and down. Somebody approach you, or you approaching somebody, and the question is, I'm not healed in our sector. I think where the healing, what are the indications that one cannot know, because it's a character, it's a behavior situation, right? So I just want to know how you could say that completely somebody has healed, because you see the person in facelift, like you see the person is coming to church, he's happily doing all sort of things, and or in the gathering in the community, and you approach the person and it's like healing hasn't gone. How could one hold to that trauma for what? I mean, I just want to know, and then what do you advise? Because if somebody approaches you, you say yes, it's not going to be dating for long, so you should be able to heal yourself before even you engage that person. But when it comes to the question of, oh, let's marry, I'm not healed, I just need a thought of that, please.
Okay. So you are asking that at what point will you know that you are healed before you start another relationship? Is that the question?
That is a piece of it, yes. And if you accept somebody's proposal, but when it comes to the issue of, okay, I'm ready to marry you, I'm not healed, you accept the person to work with the person in a relationship, whatever characters that you want to know. But the moment you hear marriage again, and these people are like, they want to come to the altar and then do their marriage or whatever they go in, but one said it's not healed. That is where the question is.
Okay. So the person is not healed, but the person is willing to start a relationship.
Yes.
That in itself is troublesome, because starting a relationship and you are not healed, chances are that even during the courtship period, you may be frustrating the other person, or you may be wasting the other person's time. And that is why this person keeps saying, I'm not ready for marriage. It's an indication that the person is not even healed enough to start a relationship. When you are healed, you come to a point of remembering all that went on, and still the intensity of the pain has been subdued, and you can still move on and be at peace with whatever might have happened and move on. That means you've dealt with the trauma, you dealt with the pain, and you are in the right frame of mind to start a new one. But if you are still saying you are not healed, yet you want to start a relationship, that is the frustration that is happening, that I'm not ready to marry and all that. It means this person is really not even healed well enough to start a relationship. It could also be fear. The fear of marriage, because maybe the pain the person went through, it's so painful to the point that when the person hears marriage, it triggers all the other emotions and the thoughts and the stress and the pain. So it could be genuine fear that the person might be going through. But this is the time that you ask questions. Are you afraid? What is your fear? Why are you not ready? What are the concerns? These questions you ask will help you to understand where the person is at, so that you will know the appropriate steps to take. I'm not ready to marry because I'm not healed. It's not enough. Why do you think so? Why are you having these thoughts? Can you explain further? Help me to understand you. I seem not to appreciate your concerns. Will you explain further? Because we've been on this for some time. It's been 3 years, and you are saying you are not healed. Are you afraid? Share with me. I'm willing to listen. That way, you are able to hear the person out and the concerns the person is having. But if the person is starting a relationship and has been on the relationship for 3 years, and the person is still saying, I'm not healed, then the person will need some help, either professional counseling or a clinical psychologist to help him or her to understand exactly what might be going on at this time.
Thank you very much.
Thank you. Someone says that he thinks that the person is just being a hypocrite, and the person is not ready to start a relationship. It could be that the person genuinely also loves the person, but the person is just afraid. That is also possible. So we explore and we try to understand. Remember, we've talked about empathetic understanding. Even though it doesn't make sense to us, we still decide to defer our thoughts or our beliefs about everything, and then we try to understand them from their frame. Okay, so please, let's move on to our next slide. Okay, so in conclusion, I'm saying that using these skills and techniques skillfully will help you to be more effective. The more the skills are used, the better your interactions, and may all your efforts pay off at helping others. Okay, so now let's look at the next one, how to intervene in dysfunctional relationships. Okay. Okay. So in intervening in relationship, especially the ones that are not working well, when they check in a session, you are going to provide them with a confidential space to share and normalize their feelings, affirming them and trying to understand them. You don't trivialize their concerns. You don't let them see that it is small. And you don't tell them, hey, my marriage, the things I'm suffering that I'm in, this one is small. No, you don't use yourself as a yardstick for the person. The truth is, two people can experience the same event, but the interpretations they will put on it will be different altogether because our personalities differs, our experiences differs, our way of understanding things also differs. And therefore, you are going to affirm them and give them a space to share their concerns by helping them to actively listen to each other. Sometimes you don't have to always interject them when they are talking, and you don't have to use yourself as a place to pass on information to each other. Sometimes give them the space to be talking to each other, even in the session, and sit quietly and be hearing them. Sometimes they don't even get the opportunity to talk to each other. They are unable to engage each other. But they, in the session, offer them that space to talk to each other and be there. Unless it's getting heated and it's getting overboard, then you interject. But give them the opportunity to hear each other, even in the session. Teach them effective communication skills and let them be aware of the use of nonverbal cues and how they can help or not help the relationship. Okay. I want to put it on slide. Okay. So active listening for couples involves concentrating, understanding, and responding and remembering what the speaker is saying. There was a story I heard. The man was watching TV and the wife went and said, how does the shoe look on me? A pastor was preaching and he shared the story, so I guess I can also share. He said this couple, and the woman came and stood in front of the man and said, how does my new shoe look on me? And the husband said, it looks very good. And the wife said, you are not even watching. I'm not in shoes. And so helping them to be fully involved when having conversation with each other, concentrating when they are having discussion. Nowadays, you can have couples going to the restaurant to eat and both of them are on their phones, or one person is on his or her phone throughout the time. And you are wondering, what did they come out to do? So helping them to concentrate, to understand, to respond, and remember information when it's being shared with them. It's very important and helps the person to feel listened to or heard. Help them to express feelings openly and respectfully. Encourage both partners to express their feelings openly and encourage them to use I statements in expressing themselves. For instance, a partner could say, you always ignore me. But you can help them reframe it as, I feel neglected when A, B, C, and D. This way, you are putting yourself in the story, you are being present, you are telling the person exactly how they make you feel, and you are communicating your present emotions and personalizing it. It might not make sense to the other party, but that is just how you feel at the moment. And it's important your feelings are heard, they are listened to, and they are addressed. So teaching them, instead of making generalized statements, you don't come home early, you don't come home early, and you leave all the children on me, and I have to do all the chores where you know I have to go for night work and all of that. You are just complaining and going on and on and on. But if you could help the person understand how that makes you feel, then you are being specific and you are demanding specific actions to be done to help the other party of the couple. Okay. Helping them to reframe their negative patterns. For instance, help the couple to look at exceptions. You say your husband never does this. Can you think of one exception he did something different? Or could you understand that if he could do this, he has the potential to do it well? You said your wife never does this. Can you think of one day she did something out of the blue, something wonderful? So helping them to see that the person might not only be the bad behavior they are talking about, but there has been good behaviors as well. Helping them to understand what their contribution is towards the conflict that must be going on. It's two people in the relationship, and they all have a role to play in what goes on in the relationship. So helping them to see how they also contribute to the challenges, to the conflicts of the relationship is also very important. And encourage them to focus on solutions rather than dwelling on past grievances. I think George asked a question about this. It's important that you encourage them that how do we solve things going forward rather than dwelling on past grievances that will not make us move forward or make any progress. So if we are Christians, we are being admonished to forgive. So how do you forgive and then move on? And forgiveness in itself is therapeutic, it's helpful, it's healing for you, the one forgiving. And so how do we solve this problem? Rather than on the past grievances and how it offends you and why you can't forgive, what solutions can we put up here? Encourage couple to foster secured attachment, being responsive, being consistent, being compassionate or empathy and caring. These are really the principles or the foundations on which healthy relationships are built. Your ability to attend to the need of the person you are in the relationship with quickly and in a caring manner. For instance, if partner A says, I feel neglected when you spend all your time on your phone instead of talking to me. And partner B respond and say, I understand why you feel that way, and I'm committed to changes and prioritize our communication. When that is said to anybody, however heightened or angry this person might be, this person will see that effort is being made to help. So it's important that we teach marriages that may be going through challenges, ask about how responsive they are and help them to understand that being responsive is also important to help the marriage thrive. Consistency. How are they willing to implement the things they've been learning in the sessions? How are they checking in with each other and working at making progress with their relationship. The next thing is compassion and empathy, gentleness, kindness, love, caring for your partner. If assuming a partner shares about his or her insecurity about job, how do you empathize with this person and offer this person support and encourage the person? How do we support each other when we share about our deepest concerns, our struggles, our difficulties, our pain? Do we use it as a weapon to be hurting the other partner all the time, but we use it as an encouragement to help the person deal with those challenges and those insecurity? And so teaching couples how to be compassionate, how to empathize. Sometimes you can't even do anything about the challenge, but the way you empathize with the person, you resource the person with energy and confidence to deal with whatever challenge that might be going on. Then the sense of care. How do we care for each other? I was listening to a TikTok, and these couple who are based in Canada, and the woman is complaining that the man never helps with anything around the house. And the woman is saying, yet you make me pay 50% of all the bills. And if I'm paying 50% of all the bills in the house, then you should also be able to help me with the cleaning of the house and meet me halfway. And it was a source of heated argument. And I was wondering why they put the camera on themselves and shared it with the whole world. But that is what happens sometimes. We lose our sense of care. And then in the process, we become very selfish in the marriage, and we look at things through only our lenses. So long as it's okay for us, the other partner must try and fit in. But that is unfair to the other partner as well. We decrease emotional avoidance, teaching couples radical acceptance, distress tolerance, and problem solving. If marriages are not working, chances are that these troubles are not handled very well. So teaching them to accept, radically acknowledge things, perspective of other person, experiences, emotions, without judgment, resistance, even if they differ from your own. Decide, I'm going to accept it as it is, and then find out how I can help this person. Assuming a partner comes and say, I feel hurt and disappointed because my partner forgot about our wedding anniversary. However trivial it might be for the other person, this other person is saying, it's so important to me. And you have to respect it and treat it as important as the person is saying, and assuring the person that moving forward, you will try not to forget it because it's important to them. Distress tolerance. Sometimes when marriages get heated and arguments very heated, it's important that you train them how to deal with their strong emotions so that it doesn't become a fist fighting or a throwing of words here and there. Because by this time, if the marriage is not functioning well, then it means that how they deal with their distress may also not be going too well. And some of the things you can teach them to do is to teach themselves how to calm down. Gladys, calm down. It might not be as bad as you think this is. Just calm down. Or the breathing exercises I taught you earlier on in our conversation, you can help them to do it. Breathe in and then breathe out. Breathe in and then breathe out. It might be a very simple exercise, but it's able to move the body from arousal to calm. It can calm you down. It can help you see things from other people's perspective because you are calm. And however triggered you are able to tell yourself, Gladys, you are not in the good psychological space right now. So will you calm down, just relax, and just listen? It's important we train couples to calm down and deal with their distress as well. And so problem solving, most of the time, the challenge is how to identify strategies using effective communication in the relationship. So helping them break problems into smaller, manageable, it could be very, very helpful and could help improve the communication. So sometimes they see the problem as very, very big to the point that they don't even know where to start solving the problem from. But you as a counselor helps them
That's
to
why you have
take
to
the
wear your glasses.
help
Because
them
bullying
to
is going to start
start
coming from it, and
dealing
you will
with
have
the
problem because you have eye
smaller
problem.
bits
You
of
have
the
to start wearing your
problem,
glasses.
breaking it into manageable
So you don't have
pieces,
it.
small. Let's start from the basics by just greeting each other every morning. How difficult will that be? And then you will expand on it gradually. So breaking the problem into smaller units and helping them see that it is not as big as they believe it to be, probably because of the tension and the confusion they might be going through. But if they should start it from the smaller perspective or bits and pieces, they can go through the problem. Helping couple understand their personality differences is also very important. Some of the tension and the struggle and the confusion in relationship is purely due to personality differences sometimes. The extroverted or the extrovert would want to talk when they are going through distress. And if as a couple you are not ready, they will look for the next person to talk to because they are under distress. The introverts want to be with themselves. They gather their energy from themselves and they want to be given some time to ruminate or think through the issues, understand whatever might be going on with them, and put things in perspective in their head before they are willing even to talk about it. So if the extroverted is telling the introverted, won't you talk about it? I want to talk about this. Won't you talk about it? It will not help and it will deepen the confusion further. So can the extroverted be made to understand that after the introverted has dealt with him or herself, will be willing to talk? Can the introverted be made aware that, look, the extroverted just want to talk issue out, and that is how this person is configured. So can you assure this person that we would definitely talk about this, but can you give me some time? Then we have sensing and intuition, how the couple gather information. The senses want things in organized structure. We say that they see life through a tunnel vision. If the thing is not making sense to their eyes, to their ears, they can taste, they can't touch, they can't feel, they can't smell. And the senses struggle to make gather information or to take in information. The intuitive person sees a bigger picture. 1 second, I want to show you an example. Assuming I show you this, I don't know whether you can see. Please, can you see?
Yes, a bottle of water. Is that right?
A bottle of water. Okay, who else sees something else? Just share your views on what you are seeing.
It's a bottle that has something liquid in it.
Okay, who else?
I saw you drinking.
Okay, who else?
I've
The
seen
label.
a
The
yellow,
label.
Okay,
the
okay,
cork, the yellowish sort of the cover.
okay. Who else sees something differently? Who
I thought I
else
see
sees something?
somewhere a light green cover.
Okay, thank you.
An empty
Who
bottle.
else? The last person. Anyone who sees something different?
I see an empty bottle.
A plastic bottle.
I see an object.
You see an object. Okay.
The lid looks
So,
like a lemon
a
green.
label on it.
Yes, it's
okay.
label.
I see a label on it.
Okay. Thank you. The intuitive person will say, I see life. Normally, when I do this experiment, you could hear one person say, I see life. The intuitive people, they see the bigger picture, they daydream a lot, and they see possibilities in everything. And the sensor is saying, show me how this will work. And the intuitive person says, I don't have reasons, but I know it will work. And they trust inspiration. And by the time you realize they've picked your money to go and invest it somewhere, and they're telling you they are inspired, they feel it will yield dividends. Whereas the sensor is saying that no, that should be structured. This thing should make meaning. But that is how we view the world based on our personality. And can you imagine these two people in the same house? We have the thinkers and we have the feelers. You know those people that when they hear there is an accident, it doesn't matter where the accident happened, whether it's close to them or it's not close to them, they start crying. Oh, and then you find them crying and you are wondering what is happening. So didn't you hear of the accident that happened? And you ask them, do you know anyone in it? No, I don't know anyone in it, but is that not a very sad story? And then the thinker is wondering, what is wrong with you? Must you know, you don't know them, it doesn't concern you. Why are you so emotional about this? Yes, that is the feeler. They empathize with ease. They assume other people's problems. They work based on values. You know that friend that when you are involved in an accident, you call one friend and the friend is saying, do you need soup? Should I bring you some soup? Have you been taken care of by the doctors? Are you okay? Should I come around? And then you ask another friend, or you tell another friend, I've been involved in an accident. And that friend says, why? Didn't you look at the traffic light? Weren't you looking? Why were you confused? And then it seems as if the one that is asking question is not caring. No. The thinkers, things must make logical sense to them. They are fair-minded, they are very objective, and so sometimes they come across as insensitive, but that is not it. They really want to understand. If you ask a thinker, how do you feel? They will be confused because they would want to think issues out and try to understand them rather than letting their emotions be all over the place. And this is a feeler who also want to empathize and understand with their emotions. So the feeler goes to the thinker and say, this dress isn't nice. The feeler, if you ask a feeler, this dress isn't nice, the feeler will say, oh, the blue one you wore yesterday, this is nice. So this is very, very, very nice. But the blue one you wore yesterday is nicer. If you ask a thinker, is this dress nice? They will tell you, no, it's not nice. They are very candid.
They speak as it is, and sometimes they come across as insensitive. So can you imagine a thinker and a feeler in the same house? And they don't know that it's personality preferences that is making them behave the way they do. And these people are having arguments all the time. You don't care about me. You don't look out for me. You don't think about me. And the person is wondering, I wake up every morning to go out there and make money to come and take care of the family. And you say, I don't care about you. Yes, care means different things to different people and different personalities. So as a counselor, you have to ask more questions to understand the personality differences that might be going on even here. Then we have the judges, and then we have the perceivers. Assuming we started this meeting and it was face to face, and I started dashing $100 to all of you, what would be your reactions? I can see 54 people here. Immediately we check in the seminar or the training, I start giving everybody $100. What would be your reactions? Oh, you are dusted. I am dusted. Okay, who else? I just checked in the session and I started dashing money. What would be your reaction? Any reaction is okay.
Yeah,
Okay.
you're very kind.
Very surprised and
very
generous.
Kind. Okay.
Yeah. Very surprised
I
and
also
generous.
think you are rich. That's why you are dashing away $100.
Rich. I am rich. Okay, who else?
Does he want to show us that she's got money or what?
Or does she want to show us she got money or what? Okay. Who else?
I would think you want something in return.
You would think I want something in return, Prince. Okay. Okay. So you see the wonderful answers you are giving. For me as a psychologist, I can already see the personalities I'm dealing with. The judge says, I want structure, I want reason, I want closure. Where are you getting the money from? Do you want something in return? Why would you even be kind to me? Do you know me? Do you want to show off to what end? Are you not going to come back and start demanding favors from me? The judge wants structure, wants things organized, wants closure, methodical. For the judge, every day is a holy day. Things must be properly thought through. Things must be planned. Things must be organized. Things must be structured. The room must be properly cleaned. The pen must be at a certain position. If you pick it from there, send it back to that same place, and all that before the judge set out of the house will mark the route that they will be traveling on. And for some reason, if it doesn't go well, for the next 30 to 1 hour, the judge is complaining. Why has this thing changed? I planned my day this way. Why didn't it come off? Now I have to restructure again. For the judge, they are so structured that when things don't go well in the structure, readjusting becomes a problem for them. You tell the judge that we are traveling to Los Angeles on Wednesday. Today is Tuesday. Let's say Friday. And by Thursday, everything is well packed for a Friday's traveling. The perceiver, for the perceiver, every day is a holiday. They don't like structure. They are energized by last-minute pressures. They want things casual, live and let me live. They don't like the word must. Things must be left, and then as we go on, we will flow. They are the ones that will tell you when we get to the road, we will find a bridge to cross the gutter. And so the judge wants the bed properly laid, the edges straight before they fall asleep. The perceiver will just push everything on the bed to one side and sleep on the other side. So the perceiver is seen as someone who is not organized. So the judge steps into the room of the perceiver and wants to arrange things. And the perceiver is saying, who came and disorganized my room? Yes. Even in their disorganization, they know where the needle is. They know where the pin is, and they can find it for you. And so the way they organize their world is different. If you say to the judge and the perceiver, they are traveling on Friday, by Thursday, the judge is done, everything is well packed. The perceiver will wait Friday morning and just be throwing the things into the bag and lock it and then off, let's go. And so imagine this personality differences living in the house together and managing challenges. If they don't understand the differences in their personality and how they see things and how they organize things, it would be a difficulty and a challenge. I am a judger. I want things structured, organized, plan ahead, prepared, and I don't like last-minute pressures. So I have a daughter that is a perceiver, and she works faster when the pressure is heightened. And sometimes when I'm leaving home, I'll give instructions. Okay, clean your room, do the bathroom, scrub the bathroom, and then maybe go to the kitchen and clean up the kitchen. I would come back and maybe the bed in the room is laid, the room is not swept. I will go to the kitchen and find out that the dishes are done, but they are not clean to be arranged yet. And I would ask her, why didn't you finish the bedroom? Then you move to the washroom. Then you move to the kitchen and get these done. But you decided to be in the middle of all of them. Why? And she would tell me, Mommy, that is round one. I will go round two and finish it off. That is the perceiving brain. That is how they look at things. You can give them 10 projects. The judger would finish 5 and tell you, I'm done with 5. The perceiver would tell you, I'm in the middle of all 10 projects. I will go second round and finish with round 2. That is how they envisage the world, and that is how they look at it. So these two people are together in marriage, and they don't know that it's preferences. That is how the mind functions. And they are in the relationship, it will always lead to tension because how they envisage the world is different, how they look at it is different, how they want to organize their world is different. Okay. So normally when we assess, we come with a personality code and we generate it for you, how you will function in a romantic relationship based on your personality and how the other person will understand a personality like yours in the relationship. I am an ENFJ. I am extroverted, I'm intuitive, I'm a feeler. That's why I'm a psychologist and a counselor, and I'm a judger. Okay. So now you bring out the strength in their different personalities. I am extroverted. My husband is extremely introverted, but the strength in his personality is that he's very observant, and whatever he says, it hits on target. He knows people at a very deeper level where I know a lot of people, but a very superficial level. And so when he's giving you information about someone, it's very detailed. And so how do we bring these, our strengths together to help us function in a relationship? What are our strengths? What are our individual strengths? And how do we synergize this strength to help us function? There are things that I'm a feeler. I'm very empathetic. He is a thinker. He's very logical. And so when it comes to giving, I will always subject it to his lenses because he's able to help me to see things from very objective point of view. But for me, immediately I see someone in need, I am in a hurry to go help the person solve the need. Whether it is my issue or it is not, I always want people to solve their problems. And that is the downside of the feeler. So he, being a thinker, helps me to look at it from a very objective point of view, to know how to go about it. So how do you synergize your differences and make you a very strong force as a couple? Acknowledging your strength, your efforts, and then the progress, helping them celebrate small successes they are making, however small it is, helping them to celebrate it. Now we go to conflict resolution. How do they manage conflict? Help them to look at things and come to a compromise. If issues are recurring, you can say that let's challenge the belief that you are always right and your partner is always wrong. How am I seeing things from the perspective of your partner helps? If you think you are always right, it's okay, and this person is always wrong, assume this person's position and look at it from the way you are looking at it and see if it helps. Now we are looking at emotions. I took you through an experiment immediately we started. There are emotions we are not aware of, and those are the toxic ones. And our inability to be aware of the emotions we are feeling and dealing with them and acknowledging them and knowing they are there, but allowing ourselves to feel it and know they are there helps us to rather act from a very informed position. But when we don't know that we are emotionally charged and we are acting, the intensity of the emotions rather would destroy everything. So helping them to understand the emotions they are feeling and teaching them how to regulate the emotions, maybe through deep breathing and changing the way they look at things. So I have a video here I want to play for you. Please, can you hear the sound?
Not yet.
No.
Please, can
Not
you hear
yet.
the sound?
No.
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 Okay, but it comes with some writing, so I think we should be able to read at least. So let's look at it quickly. Okay. So what did you see from the video? Just share your thought with me. What did you see?
Well, our response to threats or environment. That's what we need to do.
Okay. Okay. Who else saw something else?
Yeah.
Thank you.
Whether it's fear or anxiety, we respond in the same way.
Good. Good. Thank you. You see, in the first instance, there was an explosion about happening. There was an immediate danger. And so the body went through some physiological responses. The digestive system was shut, the eyes was focused on the danger, and the hormones and the insulin, the glucose level in the system is up, goes up, and then the vessels are constricted, the heart is beating faster, and it's pumping the blood boom, boom, boom into our system so that we can react to that danger. And after we react to that danger, the body returns to calm. But in anxiety, it is our thoughts that is taking us through the same process. And because it's our thought and the thought is recurrent, our body is unable to return to calm. So the person will start saying, I've been diagnosed of diabetes, but I don't take sugar. Because the body is going through intense anxiety all the time and glucose levels are elevated, it gets deposited into the system as sugar. And the heart is always beating, and so blood pressure levels are also on the high, and you can easily be diagnosed with high blood pressure, even though you might think you are not doing anything that should end up that way. And so when we are in an intense, emotionally intense environment, our body responds physiologically. And that is why it is important, it is necessary for counselors to intervene in marriages that may not be functioning well, because it does not have only psychological effect, it can have physical effect on the body, and it can bring emotional distress. Okay. And so on that note, I don't know, please let me try and see if you can hear this one too. I don't know why it is not playing. Please, can you hear?
Not yet.
No, we cannot.
No.
No.
Okay.
That's it.
Okay. Okay. So this one, we call it the 4-7 breathing technique. You use 4 seconds to breathe in, you hold the breath for 7 seconds, and then you breathe out. And when you are breathing out, make sure your lips are pursed like this. So can we practice it? Ready, go. 2, 3, 4, in. 3, 4, 5, 6, 7, sustain. 3, 4, 5, 6, 7, 8. Breathe out. Great. Let's go for the second time. Breathe in, hold, and then breathe out. Great. So these are some of the exercises you can help couples do just to regulate the intensity of their emotions. And now we get to seeking forgiveness. Help them to understand and empathize with the pain they might have caused, even if they don't believe it should hurt that person that much, or it was not even intended. Help them to understand that they are responsible for any pain or any trouble or any confusion. It doesn't matter whether you are triggered or whatever. you will be responsible for whatever might happen. So encourage them to work towards resolution, apologize where the need to be apologized, and then ask for forgiveness and encourage them to forgive themselves. And the one that has been offended should help the person to acknowledge their pain, affirm it, understand it, that it is painful. If they say it's painful, it is painful for them. And then you help them to communicate the need to the other partner and let them know that we are going to work through solution. It is not get even time. You did it to me, I will also do the same thing to you. No, it's not a time for blame, resentment, or negativity, but you communicate the forgiveness to the other partner and then you work towards reconciliation. Now, intimacy. What does intimacy mean to them? Intimacy means different things to different people. For some people, just holding hands is intimacy. For some people, just being in the chair and cuddling is intimacy. For some people, unless there is actual sex before, is intimacy. So ask them, what does intimacy mean to them as individuals? And that is how you can help them to rebuild the intimacy bridge as a foundation. Don't use yourself as a yardstick for helping them. There might be cultural reasons how they understand intimacy. There could be personal reasons how they understand intimacy. And so work from their perspective and help them to find intimacy in their relationship. Don't go projecting your understanding of intimacy on them. Understand them from where they are, what intimacy is, and then you can help them. So if these interventions do not work, it will be advisable you refer them to a professional relationship therapist for help. And so I will end up with a quote that says, fear leads to anger, anger leads to hate, and hate leads to suffering. May all your efforts pay off. At this point, I have some few minutes.
Thank you so much.
Thank you. Thank you. I saw a hand up. I was trying to get who it is. Is it Ajete?
Okay, so
okay.
Thank
So
you.
any questions? Okay.
Thank you very much, Dr. Setordzie, for that great presentation. We'll now take questions, comments, and suggestions. Okay. So please, we are, our time is up, but we'll give some few minutes for questions and then concerns. Yes, please. You can also type in if you wish, please.
Okay. Yes, my name is Matilda Ansa. My question number one, being a counselor, if I have an appointment with my with this young man and a young woman to come to my office, and myself a day before the appointment, I'm going through some challenges that I cannot attend to them. One, do I have to reschedule? Or because I have charged them, I have to pretend like nothing is wrong with me and go and meet them to counsel them. But within me, I know I'm going through some challenges which I cannot expose it to them. That's my question number one. What do I do? Question number two, forgiveness. As a counselor, and marriage couples are in my office, and something is wrong somewhere, I'm still encouraging them to forgive each other. And then here come another day. The lady decided that she don't want the relationship again, or she don't want to marry again. And then the young man will come back pleading for forgiveness. And then you being a counselor, you are aware what is going on. And then another time, the young lady accepts his apology. And then another time, the guy has, the guy is now moving all right with the young guy. But another time, you can see that the guy continue beating this young woman again. And then the lady decided, no, I don't want it again. Then the lady cut off the young man. Another time, you being a counselor, you know that it's not good to encourage those situations. But because of our culture, you see everybody intervene, oh, forgive me, it's not okay. And then the lady accepts. One night, the guy got up and killed the lady. So in this case, it's whose fault? Is it good for us to forgive situations like this, or we just have to let it go?
Okay. So thank you very much for the question. The thing is, number one, you have an appointment with your client or with a couple. For some reason, you are not in the right psychological space to see them. It is just fair you call them before they even set off to reschedule with them. That please, we have an appointment today, but some emergency came up and I'm unable to be there. Can we please reschedule to another time? Let me know your earliest convenient time, and then I will work around it. You've shown them respect, and then you've taken care of yourself as well. As a counselor, self-care is very important, because if you are not in the right emotional or psychological space, you won't be doing justice to the people you are taking care of. And remember, our job is to do no harm. And so if we are going to handle people and at the end of the day cause them harm, you are better off not seeing them at all. And so if you are not in the right emotional, psychological, or you just have a family emergency that is demanding on you, it is just fair. You call them way ahead of time, you plead with them, and then you reschedule. It is done all the time. And then with the issue of abuse in relationship, once the person's life is in danger, if the person is hitting you, the person can do something very terrible. And you always have to remember that your safety is of a primary importance. And so once somebody hits you, once somebody is violent in a relationship, once somebody is having anger management issue, it's a red flag. And as a counselor, it is people's decisions. That's what they want to do. You can't go and drag them out of the relationship, but you can only help them and ask them questions that will help them to reflect on whatever is happening and help them to understand that these are the consequences of behaviors like that. Sometimes also it could be childhood traumas that is doing that. For instance, the person was abused at home or growing up by an uncle, by an auntie, and at least here I'm being abused and he keeps saying he's sorry, he loves me. Then this person is even better As for my aunties and my uncles, they abuse me without even saying sorry to me. So it could be childhood traumas and wrong interpretations on behavioral patterns. So you engage this person and let the person know that, I know you love this gentleman so much, but I will also ask that you reflect on all that is happening and indicate what you really want out of a relationship, because your safety is of primary importance. But whose fault it is at this point, we can't really determine whose fault it is, because people must invite you into their issues before you start making suggestions or anything. And if you want to intervene, you can only ask reflective questions and tell them from what you observe, this is what you are seeing, but the decision is entirely theirs, so that they will go home and reflect on the questions you are asking them. But any form of abuse in relationship is not healthy. It's not helpful. Psychologically, mentally, physically, or anything. Because somebody can be maimed easily for life. Thank you.
You're welcome.
Okay.
Thank you so much.
George. Yes, George.
Yes, Prof. Thank you very much.
George.
I have a question about
Okay.
the problem resolution that you mentioned earlier. In the past, we have all heard that when there are issues, especially to the men, walk out, go outside, walk, come back later on, and then everything will be okay. I've been married for 21 years, and I realized that is not a true solution to a problem. Sometimes that alone will create a whole new problem. I.e., when I wanted to talk to you, you are not there, or if there's anything, you leave and I don't get a chance to talk about it. So I want you to elaborate on it a little bit. Is that, for me, I think it's a bad way to resolve issues. It may cool down tempers a little bit, but as far as resolving the issue is not going to go away if you don't confront it and talk about it and have a lasting solution. But walking away from it, sometimes it feel like you are opening a whole new kind of worm to start a whole new problem versus trying to resolve it. If you can elaborate a little bit on that too, me, as far as one of the ways to resolve issues.
Okay. So you remember we talk about distress tolerance. Sometimes the whole thing is distressing, but the person you are involved with must be heard. If you think your temper is so high at the time, you can tell your partner that, Mary, I understand you have concerns, and I understand it's difficult for you, but can you give me some time to deal with it myself, and I will bring it up for us to talk. It's not that you are running away from it, but maybe for the introverted, they will need some space to digest all that is happening. If you require them to talk immediately, you may not get anything from them. They may just be sitting and looking at you, and that can also even get you more frustrated. Unless you are willing to go on and on and on, and they are not going to say anything, and you are still fine with it. Either than that, learning to give each other some space to also deal, not necessarily moving away out of the house or not closing the chapter entirely on it. But if the introverted said, give me a little space, 30 minutes, 1 hour, let me digest what is happening so we can have a meaningful discussion. It is okay to give this person that kind of space so that you revisit the issue in a very calm and position and try to understand each other. Normally, when you leave the house and you go out, when you come back, you don't revisit the situation or you don't talk about it. and it becomes a pain in the other party who is always absorbing the pain and not getting the opportunity to discuss the emotions. One day there will be a very intensive emotional outburst, and that is rather dangerous. And so if you excuse yourself, make sure that you go back as you promised and have a discussion. Give each other the opportunity to speak, to bring out what is on their chest, and let's find a way of resolving it. We call something catharsis in therapy. Being able to talk about it, we call it the talking cure. Being able to talk about whatever challenge you are going through in a non-offensive manner to somebody who cares about you can also be healthy. So when you excuse yourself, make sure that you open the discussion up and then you communicate your emotions about how you genuinely feel about the problem. Don't be running away from it. It doesn't solve it.
Thank you very much.
Thank you.
Please, I have a question.
Okay. The question that I have is, you mentioned 4 dimensions of personalities.
Yes.
Now, as counselors, how does these 4 dimensions fit? These are behavioral lifestyles. How does this fit into the DISC mode, or the dominance, the influence, the steadiness, and conscientiousness mode of people in marriage? Do we need to know about this as marriage counselors? The DISC, or what they call it, the DISC, DISC personalities.
Yeah. Okay. There are different types of personalities. There are different tools for measuring personality, but I prefer the Myers-Briggs because it helps to understand people in the most simplest form. And so as a counselor, whatever personality style you, whether the conscientiousness, extraversion, agreeableness, or the openness, or the neuroticism, whichever personality you understand, it's important you somehow understand the people you are working with from a personality point of view, so that you can help them to understand how each other thinks and how each other, we call it preference, how they prefer to go about solving issues and all that. It's not because the person is being difficult or whatever, but it's just the person's frame. That is how this person is psychologically wired. And therefore, if I can understand this person from that perspective, I know how to position myself to understand this person, even in his most difficult moment, and how to be of support properly. How do we discuss issues, and how do we go about things? It's important you understand people from their personality perspective. And the Myers-Briggs I discussed, there are some on the net that as a counselor, you can even take the test. It will give you the results. It will tell you yourself as a counselor, your thinking style, your engagement, how you are likely to understand people, how you are likely to solve problems, how you are likely to react in romantic relationship, and all of that. And so you can encourage couples to take that test, and then they can bring their results to the session, and you help them to understand each other through the test results. It's also very helpful. Yes.
Okay, thank you very much.
Yes, like being in a relationship with a perceiver and you being a judger. The perceivers like spontaneous things. You will be there and all of a sudden they will say that dress up, we are going somewhere. The Jaja wants structured, given notice ahead of time so she can plan what to wear, which hairstyle she's using, and all that. And this is a perceiver who just enjoys being spontaneous. You can decide that you are going for a dinner, a very simple dinner, and by the time you realize you are in the movie house and you are spending the night in a hotel. That is the perceiver. They can be very spontaneous in the way they go about things. And you understanding that this person is not just trying to stress me, but that is how he wants to enjoy me. And can I understand things from this person's perspective a little? And understanding the Jaja, that this is my partner who wants some structure. So even though sometimes I can be spontaneous, can I give her time to plan way ahead for this particular thing? It's just understanding each other and then trying to find a middle ground to bring a bridge to help you live together happily, irrespective of your configurations.
Well, please, can I ask my question?
Thank you.
Thank you.
Can I ask my question, please?
Yes, please, you can ask your question, please.
Yo, me pacho the wakani na metiase pa as a counselor. Na me bisa se adofo mienu en abetna menim en na saa nneɛma yi a wabobo so nyinaa abeto menim se me ne ɔmo nkasa. At which point en na saa adofo yi ɔmo ane ba yo te ɔmo be tie afutu se ma frame o. At which point na adofo yi ɔmo betumi aka se yeah ne aba yate ne waka ni nyina yebeye ho adwuma anaasɛ me metumi a ama ɔmo be free m'anim akɔ no na de ɔmo de bae no kra no akɔyɛ wesi na culture de bia grofo ka sɛ ye ntumi nsolve asɛm nwie ntumi nka asɛm emma ne nsi me question no.
Okay, the nokra woman said the truth is the two of them came together to seek counseling from you. And so what is the goal for their coming? Adenti no mobile. Adenti no mobile. Then pana omo share nim say at the end of the counseling session, what would you have achieved? The goal for they checking in a session. That will help you as a counselor to know where you are going with the couple, because understanding the reason why they came and what they intend to achieve, and no na ebebwa amawehu baby amunyina moko. And because you set up the goal, you are just providing information. You are helping them to see things from a very realistic perspective, but the decisions are going to be made solely by them. Most of the time, we are not getting the results we intended to be because we are either influencing the process or we are taking sides or we want the process to go in a particular way. And when we do that, we are not counseling. We are not helping them to be reflective on the process, and we are not empowering them to make the decisions themselves. Once they've come and they have a goal, yours is, how do I help them realize this goal? And what role can they play in all of this to realize the goal? And that is where we set targets for the counseling process, that this is the goal for it. And if this is the goal you want to achieve, what do you intend to do? Remember, anybody who checks in counseling with you, remember and know that they have the resources to solve the problem. You are only providing direction and helping them to see the enormous ability and how resourced they are to solve whatever problem they have. So your job is to help them to see reality. And your job is to help them reflect. And your job is to ask them, how do they think these things can be solved? And they will come up with options for you. And that is where your interventions come in, whether these options are healthy, helpful for them or not. You help them to see reality in the process. Your job is not to tell them what to do, but your job is to help them to see enormous abilities and opportunities within them and how they can solve the problem as a counselor. Mijidi said, mebua wasem nama.
Mepacho, Mr. Wadaroma. Please, as someone mini abe my kind, mepacho bebre, na me so metiasia. Se me ye counselor. Efe enas party says ye who go the kode potinti a omo ba yenim. Me fan say me was second language.
Okay.
Bema mechiano ana oba bema echiano. Ba kunte ba kasa. Eso onkwala mienu edo omo ho. Womo hu se mienu no womo bobra ebeyeye. It will be well with them. Now so family in-laws can say nti ina sabi wakofa poto ni ede aba yemfie na sabi wo ye dehye na akwakwaye adwendwen ama nkwala ne mienu omo pese omo ware oba no kofie ho a abusuafo mpese omo bagye na atomu be men so nim se obeye nipo ne no bobra ebeye yie na woma ba winchen and woma ba minchen as a counselor. Na efutu ben deben pa na metumi akakire nkwalai se meshe omun crying would that encourage them to go ahead and marry or mekachiro almost say and ya wofo ekenti ana family ne kenti and ya wure tra obabi ke ko do ina here. You will never be accepted in the family. Minister, me a counselor, ya me dear say me na me catch or say woman decide say oba no ntwaso na be ma ntwaso. Nya me kan kwosini say eba ne sa na yan community na ye wom na say ye accept we kan kasa foforo we mente we kasa. Na ye bua nkwala na ase ye mbua wo mo nti no me pacha ho no so betumi aka ho bibi kakra mame ana.
Okay. So enkrofo mienu na omohia.
Right.
And omo person omo worry. And when counseling, we look at things also from the cultural perspective. And so from the cultural perspective, and the marriage is a marriage between two families.
Right.
And this is the situation the family is saying no, they won't allow it. The first question is, yebetimi ape ebusuafo no omoferifo bi na oni omo akwa kasa omo ati ase. And help them to understand that the world in itself is evolving. Things are changing. Things are getting better. And that it is not as bad as they think it is. So getting obia oye ebusiane ferifo so softwo se obi oye omo ferifo no ne omo nkasa empempi no eye niama na yentiase. And the fact that we are unsure about the family and the people our child is going into. So it's the uncertainties and the fear. But if the fear and the uncertainties can be dealt with, the families get to see that, oh, it's not as bad as they think it is. I am a Fanti. I'm married to an Eve. And I remember when I went to tell my daddy that, oh, I want to marry, I've seen someone, and I want him to come and greet and all that. And he asked that, oya benyinam so oya angunenyi. Also mama me pocho why me pocho angunenyi se man fane me fie am pocho. And
Okay.
so that is a personal challenge I have had. And I said, okay, Dada, oye, empower it's okay. But to my mama specific reason into empower. Give me some specific reasons why you wouldn't prefer an Anglo man marrying your fancy daughter. Give me reasons. And he didn't have any reason but to say that that man Krofulu won you. And I was like, Dada, you are generalizing. If you could say that this particular person is like this, then you have a reason. But now that you are generalizing, you are not making this thing any easy for me or for yourself. So just as you are telling me there, and after some months, he called me and said, Awoye, from my list. And before he passed, he and my husband were the best of pals. And it changed his perceptions and his belief system about others. And he was working just from a perspective of fear. So sometimes it's the fear of the unknown. And sometimes perceptions around the environment about a particular tribe that put fear in parents to release their children into going into that tribe. But if they can get somebody to allay their fears, somebody to talk to them, somebody to engage them and give themselves some time, sometimes it helps in dealing with the pain and the fear and the uncertainties they might be going through as parents. Thank you.
You're welcome.
Okay. Thank you very much.
Thank you, Doc.
Thank you. God bless you so much.
Thank you,
God bless you.
God bless you. God bless you.
Wonderful.
Enlightening.
Excellent presentation.
Yeah.
Thank you, Doc.
That's very nice.
So much
Welcome.
Thank you so
this
much.
evening.
Thank you.
Thank you,
We're
Prof.
grateful for your time too.
For your
Yes.
time,
Thank you.
everything.
Great
Thank
insight.
God bless you, Prof.
God also bless you.
Thank you. God bless you
Thank
all.
you. Thank you.
Thank
Bless
you.
you so much.
Offering time,
God bless
offering
you.
time, offering time.
Prof, I will share with Mr. Lamte tomorrow how great you have been.
Oh, thank you, sir. Thank you. Thank you so much. Okay.
God bless you.
Okay.
Okay.
Bye-bye.
So, Dr. Setordzie, thank you
Yes,
so much. Thank you so much for
Thank you too.
all you've done
you.
tonight and all your responses. They've been very
Thank
great.
you.
And
Thank
then we thank you all, our participants, for all your great questions and your suggestions. We have come this far by grace. We have done our third session, and we are going on to our final session, which has to do with ethics in premarital counseling. So all your concerns, how do you address them in the right way, the best way you should go about, providing counseling? So we'll have our presenter next week to take us through the ethics of premarital counseling. We are grateful to you all, and may God bless us all.
Amen.
God bless you.
Thank you.
Thank you on behalf of the class. We also want to say thank you to the entire faculty. Say thank you. Thank you to the coordinator, Dr. Uti Gwedi, and to our dear mother. We enjoyed it. Some said they missed the first exercise. And glad that we continued and we had a few also at the end. So thank you. Thank you. The North America Australia Presbytery is happy to have you. Thank you. Thank you, and God bless. God bless you.
All right. Then have a good evening.
Good night. You do. Good night.
Bye-bye to you
Good night.
all.
Bye.